Hi everyone, this is the last screencast for this semester. This last slide set, as you can see, is in regards to self-care. We talk a lot about self-care as being, what we give patients to do when they leave their treatment. But self-care can also represent you taking care of yourself and avoiding things like burnout. So, we're going to talk about what that is. We're going to talk about coping strategies and the kind of stresses and how to recognize and work within that context. So we've heard the term self-care burnout before. So it does describe a wide range of states ranging from feeling generally tired to completely overwhelmed and unable to manage the demands of everyday life. So ultimately, something we need to think about is how can we determine when this represents where we might be on this continuum of self-care. Make sure that you watch this video. I think it's very important. It will give you a sense of sort of identifying areas that may cause burnout. It is based a little more on family physicians or doctors in general, but it's still healthcare, and it still talks about students in healthcare curriculum and the kind of stresses that they're under. I think you'll find it relatively interesting. So when we think about then symptoms, how do we know maybe when we're getting towards that point where we're going to burn out? Well, something called emotional exhaustion. So, that leaves us possibly cynical, short-tempered, uncaring, and so forth. I think we'll talk a bit about that in class on Friday, but understanding that when you start recognizing these things, you have to move forward with trying to be proactive about them. Decreased motivation. Want to go to work and every day or get out of bed or whatever it might be. Negative opinions. I used to work with a physiotherapist who knew when it was time for him to take a holiday, and that had to do with his cynicism. The more cynical he became, the more he recognized that he was burning out and he needed to step away and take a holiday. So we do see a rise in negative opinions about people and coworkers. You become less effective at work. You're not as available, or you're not working as hard, or you're motivated to be doing things and getting things done on time. Generally speaking, then, we say that burnout is complex. There's a lot of stuff happening in burnout. So what I would like you to do next is I want you to use this hyperlink, and I want you to go on to the Canadian Mental Health Association's work-life balance quiz and have a look and see how your work-life balance is. I'll bring it up a little bit in class, but ultimately, if your scores are low, you need to start thinking about making changes in your life. Conversely, if your scores are high, then you're probably doing a lot of right things towards avoiding burnout. One of the things, especially in the talk on this slide here, is talking about females. There is a discussion here that females seem to burn out at a higher rate than males do. And sort of ask yourself, why? Why might that be? Why might females be more sensitive to burnout? Or why do we see it more often? And as a gentleman said in the YouTube video, he's not trying to make a comment in regards to women versus men, but we do have to look at the numbers and ask ourselves, why are we seeing this? So the other part of this, of course, is personality type. The type of person we are as well sort of indicates how well we may avoid or end up being burnt out. So the big five personality types: conscientious, agreeableness, neuroticism, and openness. So, let's go for conscientiousness first. Predictable, well-ordered kind of environment we need, or expectations, so everything has to be perfect. When it comes to emotional exhaustion, highly predictive of burnout when faced with chaotic or unpredictable environments. When we think about depersonalization, when expectations require a high degree of adaptability and flexibility, these folks can't deal with it. And highly predictive of burnout when commitments or expectations exceed capacity or a choice of outcomes is taken away. So this kind of individual, these are sorts of things that will lead them to moving towards burnout much faster. The agreeableness, the pleasant, cooperative, friendly, empathic types, they like to network. These are kind of caregivers, generally speaking. It's not strongly correlated with burnout. So Emotional exhaustion, if agreeing at the expense of personal integrity, is a big thing here. These are the individuals who will make decisions and, shall we say, sacrifice themselves to do something else. And part of the problem here is that one needs to recognize your own integrity of what's important to you, and see if you're moving out away from that. When it comes to depersonalization, when expected to be positive and accepting, this kind of individual will, in the face of bullying or something that's not, I wouldn't say abusive, but possibly abusive, this can lead to this depersonalizing of themselves. And of course, reduced personal accomplishment is when their efforts are thwarted or manipulated. So these folks these smaller things can sort of cause some burnout, but this tends to be the individual who's less likely to get burned out. Neuroticism is sensitivity to negative cues and the presence of threat, tendency to experience fearfulness, irritability, low self-esteem, social anxiety, poor inhibition, or helplessness. This group is also highly predictive of burnout. These folks also can have sleep disorders. They're prone to anxiety, depression, and emotional vulnerability. So because of that, they're much more sensitive to running into emotional exhaustion. As far as depersonalization, again, this type of personality is highly predictive of burnout in this way. This could be social sensitivity, fearfulness of things, don't want to move in a direction because they're quite fearful. They're irritable because things are bothering so much. Daily tasks are more difficult for these folks, and these individuals can have high levels of cynicism or frustration with others. So they're always looking at others in that way. And of course, reduced personal accomplishment. This has to do with their high self-criticism and low self-esteem. There's an imbalance there between those things. They're criticizing themselves all the time, and they don't see the good in that they do. The last one is openness, creative and receptive to new ideas, likely to experience positive emotions and delight. These folks, this is being open helps protect one from burning out. So being creative, being able to bend, being able to be receptive to new things, this can lead to not farther, but these people tend to be able to avoid burnout much more in all areas of here. So if we take this away, then being agreeable, being open, being cooperative, being creative, being receptive to new ideas, having strong social networks, these are the things that help us to avoid burnout. So if we find ourselves in constant stress, in constant burnout, it can and has been correlated to some diseases such as type 2 diabetes, myopathies and muscle atrophy, high blood pressure, impaired tissue repair, reproduction issues, and digestive issues, and possibly shutdown of growth issues. So there is something to be said here. One thing that is not here, which could be somewhat related to the high pressure thing, is inflammation and higher amounts of inflammation, inability to stop inflammatory reactions, and in doing so, related to the heart, may therefore increase the potential for a heart attack. So thinking of all these things, your personality, what it is you want to do for a living, and knowing that there's a lot of value placed on healthcare workers, and that leads to a lot of pressures. What you need to think about within your own career is, how do you manage it? How do you prevent burnout? I mean, we always hear in massage, when we hear the term burnout, we think about body parts falling apart, hands falling apart, fingers, wrists, arthritises, and so forth. But what about the emotional stuff? Some of you are going to be working on your own, and maybe for the first time, managing your own money and your own profits to keep your business viable and keep moving forward. The other thing is, if you think about how many massages you guys are doing a week at this point, now multiply that considerably when you are now practicing on your own, maybe doing anywhere from 4 to 7 massages a day. So this is going to place a lot of demand physically on your body, and how are you going to manage that? You're going to be dealing with people emotionally and psychologically, so that is going to start to take pressure and place it onto your own emotional and psychological needs. So when do you start to manage that? How do you manage that? Overcommitment. We are individuals who like to give of ourselves and be part of and get involved. And sometimes, there's an old saying, spreading yourself too thin. Quite often we can find ourselves in those situations where we're just doing so much and too much and working constantly and so forth. The last one is, believe it or not, pricing. And I can tell you from experience, it took me a number of years to increase how much I charged for massage. And part of that was fear. I was quite fearful that if I raised my prices, no one would want to come to me anymore, that they think I was being selfish and too expensive. You need to learn to value your service. You need to recognize that you offer a service and that as a healthcare worker, at the prices we charge, in most cases, we're probably undervaluing ourselves, and we need to start valuing ourselves and having remediation in regards to that, getting paid the appropriate amount. So think about that. Think about what are you worth to your patient, and what does it cost you to do what you do. If we think about the physical demands, we think about the emotional and psychological demands and the commitments that we need to make in this profession. Are you getting value for your service? Or are you charging enough for those who value your service? It's something that one really needs to consider. Longevity. This is the big one. Whenever I tell people I do massage, the first thing out of their mouth is, people don't last long. The question becomes why? Is it just physical? Is it emotional? And all these other things that we've talked about. So one needs to think about the number of hands-on hours per week. Because I was teaching, didn't do your traditional 20 massages a week. So I got a lot of time out of my hands, some 25 years. The question would be whether or not, my hands would have lasted that long if I was working full-time in massage therapy, doing, vast numbers of treatments per day and per week. If we think about things such as alternate modalities, you can use hydrotherapy that may soften tissues and save your hands. Don't forget about your remedial exercise component. So, maybe 1 or 2 days a week, you have periods of time in your clinic where people are coming to you and they're doing exercises and things for their clinical presentations that are not hands-on modalities. So there are other ways to avoid doing hands-on all the time. You can use tools. There are thumpers, there's a thumb saver type of thing, there is acupuncture, there is cupping and so forth. So you may want to think about adding some of those things in. Electric or hydraulic tables help a lot. It's easy to get up, easy to come down, ensuring that whatever modality you're doing on your physical body, you're always at your best posture to perform it. You as a therapist as well need to eat properly, get lots of rest, make sure you're in shape to do your job, and hydration. So you need to really start thinking about getting into shape to do this as a career. And of course, here in STARS is all alternative modalities should be part of the scope of practice or practice following the registrant's appropriate regulatory college's standards of practice. So although I may have talked about cupping and acupuncture, of course, those are the sorts of, you have to go to school and get education to perform those tasks. Plan with purpose. So we are constantly acting in the best interest of our clients. To look after others, we need also to look after ourselves. So we need to start thinking about how do we plan our career out, weekly, monthly, yearly, and so forth. So you need to think about realistic short-term and long-term goals, things that may come up within the context of your practice, techniques you might want to learn, diets, eating appropriately, getting back to exercising, and so forth. Swap services with other healthcare professionals in your office on a regular basis. So maybe, you're in a multidisciplinary clinic and you need some physio or some needling or some specific remedial exercises and those sorts of things. Work with them. They'll work with you. You work with them. Set boundaries. Do not be working day and night and having consultations all the time, being available whenever. you've got to set boundaries so that you can spend time for yourself, with yourself, or with your family, or your loved ones, whatever they may be. Have vacation. It's vitally important to have vacation. You need to take the time to do that. I know there's bills to be paid and mortgages to be paid and so forth, but you need to somehow work that into your money management and emotional management. Doesn't necessarily mean you have to be going to the islands, but at least you're getting away from the office and you're doing something for a somewhat extended period of time. So now I want you to consider how the chart on the next slide can assist you with meeting your financial goals without causing burnout. So we'll take a moment here and think about how we try to lay ourselves out in a somewhat manageable way to see what we're looking at. So if we we look at 8 hours per day at 1 hour, so we have a lunch, we have price of treatment at 80, number of people per day at 6, contact hours, total working hours is 7.5. Our contact hour is 80, our working hour is 64 per day, is close to 500 at 5 days per week. Is looking at about $115,000 a year. So two things here. Lovely money, pays a lot of bills, but it's a hell of a lot of work, a hell of a lot of physical labor. Question is, can you work in this context? At the extreme other end, is the half hour, 8 hours per day and so forth, and you're looking at difference in the way this is all out. So take a moment, sort of work your way through this. Think about your charge of treatments and the number of treatments you would see or people you would do each day and so forth. And you can see how you can sort of lay out financially how you might be able to do things like take a vacation. So a couple of little videos here. They're not very long, but have a look at them and listen to them because they're quite interesting. The first one is sort of a news article where they're following an emerged physician who has a family life and everything else she does in terms of her personal professional life and the thoughts around how that leads to medical errors. And then President Obama sort of talking about some of the things that he had to deal with at the presidential level, and how his personality and some of the things that he did to avoid burnout were important to him. The thing to remember about figuring out coping strategies is burnout. So when we read this line here, burnout among physicians is a crisis in medicine that can lead to medical errors. No different for us. If you find yourself working too much and you're burning out, you're just as likely to make mistakes from the context of massage. So making sure that you're taking care of yourself, that you're in the right place to be working, it's vitally important. So encourage clients and caregivers to access services to reduce stress. So, personal support workers, counseling, support groups, community services is and you as well. That's what's so important. Accept offers from friends and family to help out. Don't be so caught up in thinking that you have to do everything when you don't. Listen with an empathetic ear. Take that time to listen that way. Take breaks in the day. One of the questions on the one sort of stress survey or questionnaire there was, do you take a lunch hour? So are you going to book time for lunch for yourself, taking an hour off, having something appropriately to eat, and just getting away from it? Also, taking care of yourself through exercise, meditation, possibly yoga, mindfulness, nutrition, and so forth. Ultimately, as caregivers, we as massage therapists, we have to be mindful of the effects treating clients with chronic conditions can have on their physical and emotional health. So if we're not in the right place, then how can we possibly help these individuals who may be dealing with their own physical and emotional health issues? Thanks. This is the last one for the semester, and I will see you guys on Friday.